The idea of radiation therapy can be pretty daunting, and let's be honest, a huge part of that fear comes from the side effects. But what if we could strip away all that mystery? What if these effects aren't random, but are actually predictable and, more importantly, manageable? Well, that's exactly what we're going to get into.
And that right there, that's the core idea we're going to unpack. This isn't about just crossing your fingers and hoping for the best. It's about using the actual science of radiobiology to stay in control, to make the treatment not just more powerful, but also a whole lot safer.
Okay, so that's the big question, right? We're going to pull back the curtain on the biology behind these side effects, and we'll see exactly how knowing this stuff helps doctors protect their patients every single day.
First things first, we've got to wrap our heads around a pretty fundamental concept. At its very core, radiation therapy is actually a very, very carefully controlled therapeutic injury. Yeah, I know, that might sound a little weird, but it's the absolute key to why it works so well.
So here's the really brilliant, kind of paradoxical part. Radiation damages the DNA in all the cells it hits, both the cancer cells and our healthy ones. But here's the kicker. Our healthy cells are rock stars at repairing that damage between treatments. The cancer cells, not so much. So by giving the radiation in these small, daily doses, we give our healthy tissue a chance to bounce back, while the tumor cells just keep taking hits they can't recover from, until they die off.
So all of this leads to side effects. But here's the thing, they're not all the same. They actually fall into two really distinct categories, and it all comes down to their timing and, most importantly, the biology behind them.
Okay, so this chart really breaks it down perfectly. You've got your acute effects. These guys show up fast. We're talking during treatment or within about 90 days. They hit the tissues with cells that are dividing all the time, like your skin or the lining of your mouth. And the good news? These are almost always reversible. But then you have late effects, and they are a totally different beast. These can take months, sometimes years, to show up. They affect slow-growing tissues, and they're not caused by cell death, but by long-term damage to blood vessels, which can lead to scarring. And that's why they're often irreversible.
And this brings us to a super important takeaway. Just because a patient gets a pretty bad skin reaction during their treatment, it does not mean they're destined for long-term problems later. Why? Because they're caused by completely different biological processes. Knowing that is incredibly reassuring for everyone involved.
All right, so we've covered the why. Now let's get into the what. We're going to take a quick tour of a few of the most common side effects just to see these principles in action. Probably the most common side effect you'll see is radiation dermatitis, basically a skin reaction, and it happens for a very simple reason. The radiation damages the basal keratinocytes. Think of them as the little factories at the base of your skin that are constantly churning out new skin cells. When those factories get damaged, skin production slows down, and you end up with redness and irritation.
And the cool thing is, managing it is super predictable. It's a graded response, as you can see. If you have grade 1 redness, use moisturizer. If that gets worse and you have some peeling, that's grade 2, and you bring in a topical steroid. Grade 3 requires special dressings. It's not guesswork. It's a clear, step-by-step plan.
Now, take that exact same idea and apply it to the inside of your body, the mucosal linings. For treatments to the head, neck, or chest, this is called mucositis. It's the same biological process as the skin reaction, but it's happening inside the mouth or the esophagus. And as you can imagine, that can cause a lot of pain and make it really tough to eat or drink. And that begs a really critical question. Beyond just making the patient more comfortable, why is it so incredibly important to manage this specific side effect?
Well, it all comes down to this simple, powerful fact. If mucositis gets so bad that a patient can't eat and starts losing a lot of weight, the treatment might have to be put on hold, and every single break, every missed day, is another chance for the cancer to regrow. So aggressively managing these side effects isn't just about comfort, it's literally part of making sure the cancer gets cured for good.
Okay, now for something really fascinating, a truly unique side effect called the radiation recall phenomenon. This is wild. It's when tissue that got radiation months or even years ago suddenly gets red and inflamed again, but not from more radiation. It gets triggered by a totally different drug given later on. It's like the tissue has a long-term memory of that radiation.
And this memory gets jogged by a very specific set of drugs, often chemotherapy agents like these. It's just a perfect, if strange, example of how the biological effects from radiation can hang around in our tissues long after the treatment itself is finished.
So with all this knowledge, how do medical teams actually stay ahead of the curve? How do they stop these things from day one? It all comes down to having a proactive management playbook.
Well, it all starts with protecting what we call organs at risk, and we do that with hard safety limits that are baked into every single radiation plan. For the spinal cord, the dose has to stay below 45 gray. That's the unit of dose. Why? To prevent paralysis. No wiggle room. For the lungs, we look at something called the V20. It means less than 35% of the lung can get a moderate dose. These aren't just suggestions. They are strict rules built on decades of safety data.
And we can hit these incredibly precise targets thanks to some amazing technology. Techniques like IMRT are like a super sophisticated GPS for the radiation beams, shaping them to perfectly wrap around the tumor. Image-guided RT, or IGRT, is like taking a quick picture right before every treatment to make sure the aim is perfect. And then there's DIBH. This is so simple but so brilliant. The patient just takes a deep breath, and that physically moves their heart out of the way of the radiation beam. Amazing. So you take all of this, the biology, the tech, the proactive game plan, and it all comes together in what you could call the oncologist's promise. It's a deep commitment to both precision and patient safety. And that promise really stands on 5 key pillars. It all starts with making sure the patient is held perfectly still and that the tumor is drawn with pinpoint accuracy. It means sticking to that daily dose schedule and never missing a beat. And, crucially, it means jumping on any side effect the second it appears, not waiting around for it to get worse. And that really brings us to the final, most important takeaway here. Seeing a side effect isn't a sign that treatment is failing or that something went wrong. Not at all. It's an expected biological response. The entire goal of modern radiation oncology is to anticipate it, use incredible technology to minimize it, and have that playbook ready to manage it the moment it appears.
Which kind of leaves us with one last big thought to chew on. As we get smarter about the biology and our technology gets even more precise, we're not just getting better at killing cancer. We're getting better at doing it in a way that truly protects the whole person. So the future isn't just about being more effective. It's about being more humane.